I hate writing notes because I don't do CBT, but since insurance only covers CBT, I have to make my notes sound like that. This is a really common myth that's perpetuated in a lot of trainings that many of us receive in agencies or nonprofit organizations. Hi, I'm Dr. Maelisa McCaffrey, founder of the free private practice paperwork crash course, and in this video we are busting the myth that you have to use CBT language in your progress notes if you are worried about insurance. Honestly, insurance doesn't necessarily care about seeing CBT, but they do want to be able to see how therapy is helping your client. They also want to know that you are worth paying for to make that happen, and that's regardless of whatever modality you're using. To dig into this further, we're going to break this down into two categories for your note: what you're doing and how your client is progressing. For the first part, what you're doing, an easy way to frame this is something I like to call the grandma rule. So the grandma rule means that insurance doesn't want to pay for anything that your sweet, loving grandmother could do for you in a conversation. They want to pay for things that you needed a master's degree or a doctorate degree to learn to do with clients. So assuming you have a good relationship with your grandmother and you went to visit her, would you expect her to actively listen to you, be empathic? Those are things that are sort of inherent to therapy and don't really need to be in the progress note as an intervention that you provided. Basically, if anyone's grandma could do it for you, I probably don't need to pay a therapist to do it. Now, it's not wrong to have these phrases in your progress notes, but insurance isn't going to view those as active interventions that they want to pay a therapist to provide a service for. So what does insurance want to see and pay for? They are happy to see things like explored feelings, identified coping strategies, introduced a strategy or a concept to the client, provided psychoeducation on a topic, or you could even review progress in therapy. If you want more details on interventions specifically, we'll link to a video that really dives into just this one topic. Okay, our second category is how the client is progressing. Now, I'll admit, it is difficult to put a lot of the therapeutic change that your clients see into observable phrases. However, I would also encourage you that it's really helpful to become comfortable identifying what is actually happening in therapy. And that helps both you and your client. The easiest way to do this is ask your client, what progress do they feel like they've made over the last week, over the last month, over the last few months, etc. What did they struggle with? What haven't they been able to implement? What were they able to change? How do they view things differently now? What do they view differently? Do they see themselves differently? Their situation? We could go on. And use whatever phrasing or terminology makes sense for you and works with however you work. The point is helping your clients connect the dots with how therapy is impacting them. And when you're talking that through with your clients, you are very likely to come up with more observable language. So you can imagine this can be a really powerful clinical conversation, and it also helps your progress notes. And when you have your clients involved, it takes a lot of the pressure off of you. So remember, when it comes to progress notes, don't think CBT, think observable. Think about how you used your actual grad school training and focus on that. I know it can still be difficult to listen to a video like this and then actually put it into practice, so I have a cheat sheet for you to use. I've created a simple formula that you can use to make sure you are adding in a progress statement into every progress note. This one statement captures a lot of what we talked about in this video, and it's essentially what insurance wants to see in every progress note to justify medical necessity. So we'll link below where you can enter your email address and get immediate access to that cheat sheet. Yes, you do have to enter your email address, and no, I promise I won't spam you. But I will send you an email each week when I do a new video. So if you don't want that, you can just say to yourself, thank you, Maelisa, for this amazing free resource, and then quietly hit unsubscribe in that email, and you won't get any more. Okay, until next time, happy writing!